Recording in
Hi
progress.
everyone, this is Janet Hill at the Rock Island County Health Department. Thank you for joining us. It's 3:30 p.m. on June 28th. Today we are here to talk about the Delta variant. We have Dr. Lily Katz with us to make most of those remarks. First of all, we will have Nita Ludwig from the Rock Island County Health Department and Amy Thorston from the Scott County Health Department give you an update on cases. Let's start with you, Nita.
Hi, good afternoon. So today we are reporting 5 new cases of COVID-19 since Friday, and our total now is at 15,004 cases for Rock Island County. Our deaths remain at 333. Regionally, positivity is at 1% for Region 2, which Rock Island County falls into, and the statewide positivity rate is 0.8%. Going forward, we will report cases only once a week on Monday now, and the next report will be July 6th because of the holiday. As far as vaccination data, we have now administered 111,436 in Rock Island County, and our 7-day rolling average is 316. We do have over 53,000 fully vaccinated. And the breakdown of that is age 16 to 64, we're currently at 44.8%, and over 65 is 76%, so that's really good. The state does not break down currently the 12 to 15-year-olds in our county, but statewide, 12-year-olds and above have about a 53% vaccination rate. In Rock Island County, here at the Health Department, we are having vaccination clinics on Tuesdays and Fridays from 9 to noon and 1 to 4 p.m. On Tuesdays, we offer Johnson & Johnson or Moderna vaccine, and on Fridays, we offer Pfizer vaccine. And again, all of our countywide pharmacies are also participating with various vaccines, and to find your own shot, you can visit vaccines.gov. Thank you.
In Scott County, we've had 21,768 positive tests. And similar to Rock Island County, our positivity rate for the last 7 days is 0.9%. We've had 249 deaths. When you talk about vaccine, 140,235 COVID-19 vaccines have been given by providers here in Scott County. When we look at our own population, we're at 54.5% of the 12 and older population fully vaccinated, with 60.8% of that same group having had at least 1 dose of vaccine. As we look at the 65 plus, we are at 84.2% fully vaccinated and close to 90%, 88.9% having received at least 1 dose. It has been a few weeks since we have proactively addressed our media and the public with important COVID-19 messages. This is for a few reasons. Number one, we are fortunate enough to have finally reached a low and more steady point in this pandemic, where spread of the virus is limited and new cases are more infrequent. The decrease in cases in the Quad Cities and the easing of COVID-19 protection recommendations have been welcome changes, particularly when compared to last year at this time, when we were warning about an increase in cases and we were talking with event organizers about changing their events or canceling them altogether. One of the primary reasons we are at this stage is the highly effective vaccines to which individuals 12 and older have access to in the United States. The second reason is the Vaccinate Now message has been spread far and wide. We don't need to be saying it every single day, nor do you want to hear us saying it every single day. And number three, we're trying to find the appropriate balance between keeping our community informed and being too present so that the community tunes us out. The challenge with COVID-19 is that this virus isn't ready to be done with us. Public health has been watching the spread of the recently identified Delta variant and we are seeing alarming reports of the impact that variant is having. It is spreading primarily in unvaccinated individuals. We have invited Dr. Katz, our medical director, to join us today to provide an overview of the Delta variant, what he is hearing in the infectious disease world, and to discuss why he continues to recommend getting vaccinated against COVID-19 sooner than later. Dr. Katz?
Thanks, Amy. Brooke, were you going to show the epi curve? Yeah, this is our epidemic curve. And I think anybody who's been on these calls has seen it multiple times in the past. And I think the good news is the right-hand side, despite Delta, we have not yet seen interruption of our downward trajectory that was established in mid-April. So Delta used to be called B.1.617.2. So I guess Delta is a little less of a mouthful. This variant was recognized in the Indian subcontinent in October last year. Didn't do a lot for several months, but during April and subsequently, it has been responsible for an ongoing catastrophic surge there, with tens and actually hundreds of thousands of deaths, hospitalizations, and collapse of the healthcare delivery enterprise in many places there. It's now in more than 90 countries. We have data that's probably applicable to the United States, coming especially from the United Kingdom and Israel, where this variant has replaced what we now call Alpha, the UK variant, or B.1.117. B.1.117. Delta is 50 to 60% more contagious than that variant, and about twice as contagious as the original wild type virus that started the pandemic last winter and spring. The early data from the United Kingdom and Israel is telling us that even in developed jurisdictions with high vaccination rates, looks like it's about twice as likely to put infected people in the hospital as the Alpha variant. It has spread in the US and it's on schedule to become the dominant variant over the next several weeks. Of particular concern to us is that half or more of the infections in Health and Human Services Region 7, that's a big swath of the Midwest, are Delta variant, and that includes the sequencing that's being done at the State Hygienic Lab at Oakdale. I've spoken to the leadership there as recently as Friday afternoon, and we're past 50% in terms of our sequence variants being Delta. Nationwide, the rate is between 25 and 30%. The available vaccines remain effective, albeit at somewhat lower rates than for wild type. The good news is that certainly the mRNA vaccines and probably the J&J vaccine appear to provide very, very good protection from severe illness and death. So in fact, breakthrough infections are occurring at a higher rate than we had seen previously, but the effectiveness of the vaccines against getting sick enough to wind up in the hospital and die appears to be pretty well maintained. Early information suggests that Delta may be worse in younger individuals than the prior variants, but this needs extensive confirmation, and I'm not sure I trust that data yet. It's a lot of anecdotal stuff, and we really need a lot more experience and well-designed studies before we say that. It may be producing an illness at least a little different from what we've gotten used to with COVID-19, with maybe more GI complaints and possibly looking a little bit more like a common cold initially, than previously. We'll see as the cases accrue, but I think the main message is that if you're sick, you need to be tested. If you have GI illness or a cold, or the more common lower respiratory manifestations that we recognize with COVID, you need to get tested so that we can keep our surveillance accurate. In developed countries where it has become dominant, and this is especially the United Kingdom and Israel, reestablishment of distancing and mask mandates and travel restrictions that had been being rolled back are underway to control spread. And essentially in the UK, they have suspended their full reopening from originally planned for June 21st to July 19th or 20th next month while they assess the impact. Whether that's going to happen here or not is speculative at this point. If you're fully vaccinated, the current CDC recommendations, distancing and masking and physical distancing, social distancing and masking are really not effective at this point. WHO is rolling back some of their relaxed recommendations. CDC has not moved in that direction yet. If you are not fully vaccinated, you should be avoiding crowded venues. You should remain masked at indoor settings where you will be coming into contact with other unvaccinated individuals, and continue with physical and social distancing as has been recommended for almost the entire pandemic. We know, as you have heard, that in Scott County, only about half the population is fully vaccinated. The vaccine is widely available for all 12 years of age and older, so that if you or people you know remain hesitant about receiving these remarkably safe and effective vaccines, you should immediately be in contact with your health care provider to discuss their position on these issues. And we have a lot of information at both county websites if needed. And of course, the CDC website is an exceptional resource. Our greatest concern right now, in addition to whatever the illness burden we will see during the coming weeks during the summer, is that Delta Plus, which has an additional mutation or two, and subsequent variants that are going to emerge, not be allowed to derail a return to full in-person schooling in the fall. So we really are encouraging everybody in the community to follow public health recommendations so that our epidemic curve doesn't turn in the wrong direction and we don't have to reconsider more restrictions than we're living with now. So with that, we can take questions, I think.
Thank you, Dr. Katz. We appreciate that information. I'll give it another minute here or so and see if we have any of our media partners who want to type any questions into the chat for us. Okay. Not seeing any at this point. Oh, here it came through. What does Dr. Katz say to people who are hesitant?
Well, I guess that one best leads example, and as I told you repeatedly on these calls over the last several months, I was in line for my vaccine before I was eligible to get the vaccine, and I immunized my lovely bride at the first possible opportunity, and my children as well. These vaccines are safe. The risk from an episode of COVID is orders of magnitude higher than any risk recognized from the vaccine. And we're now worldwide at almost 2 billion doses administered, well over 300 million in the US. There's a lot of bad information and information with no context available on social media. And this is why we're encouraging people who have questions or are hesitant to talk to their trusted healthcare providers.
Dr. Katz, to follow up to that, just based on things we've heard over the last weeks and months, can you describe why public health and sort of the vaccine creators tend to look at that short-term effects of vaccines compared to, and comfort with, approval based on that compared to long-term? We're hearing lots of people who are interested in watching for long-term effects, but can you kind of describe what you see with vaccines and how you learn so much from this early time frame?
Well, first of all, the vaccines were not granted emergency use authorization without reams of safety data that extended out beyond where there was any precedent for identification of common serious vaccine side effects. So it was a median follow-up of over 2 months, which is as good or better as than other vaccines that have been considered for emergency use in the past. That said, we're now more than a year past the first immunizations. And the two adverse effects that have been described since completion of the phase 3 trials, the clotting problem and the myopericarditis issue that has emerged in recent weeks, are incredibly rare in comparison to the complications that occur from infection with the virus. And that's particularly true for myopericarditis. Estimates from CDC are very early on, but the risk of heart involvement from natural infection with COVID is many-fold higher than the risk of myopericarditis from the vaccine. So I look at this and say, if I'm going to take my chances, the chance I'm going to take is as a fully immunized individual. The other thing that I would say is that the emerging evidence is very strongly suggested that vaccine-induced immunity is both more potent and probably longer lasting than immunity from natural infection. So, I spend all day, every day looking at this literature, and I think not being vaccinated is Russian roulette.
There have been other variants we've been warned of. Are they still a concern, as you mentioned, with Alpha and some others?
Well, yeah, I mean, the variants of concern right now are Delta, because it's growing so rapidly, and we have early signals that it's substantially more transmissible and perhaps more dangerous. Same can be said of what we used to call the South African variant. We call it Gamma now, but it's never taken hold in this country, so I'm much less concerned. Delta is so much more transmissible that it is displacing the other variants of concern. And there's a variant of Delta, it's called Delta Plus, that looks even more transmissible, but it hasn't been established yet as one that's likely to displace Delta itself. Delta's highest on my list now, but the virus has clearly over time evolved to be more transmissible and perhaps more pathogenic. So, every week we watch, we look at the data as it evolves. Signal that is most important today is that the vaccines for which we have emergency use authorization in the US continue to provide incredible protection against severe disease. I don't know next week, September, or in winter, when people are crowded indoors again. I do know that by taking these vaccines, that are incredibly safe in real world use in literally billions of administrations that to prevent kinds of catastrophe that we have seen in swaths of the developing world.
Sorry, I think it kind of trailed off at the end there, so I apologize.
I'm just finished South African. I can't predict the future. And if you want insurance, the vaccine is the insurance you should be purchasing.
Dr. Katz, do you have any concerns about vaccines in younger people, such as teenagers?
No, the infant in 12 through 16
Okay, I think we're running into a little audio difficulty here. What we will plan to do is, I think there was one additional question that came through the chat, so we will.
is that profile in 17 to.
Okay, we will make sure to get those questions answered as we are sending out our press release. So thank you to all for joining us today. I'm sorry about that little technical difficulty at the end. We will post the recording on our Facebook page as well as our websites, and we will get a press release out to you shortly. Thank you all for being here and for joining us. And again, as new information comes that we need the community to be aware of, we will connect with you and make sure that you are with us to help share that. Thank you again, everybody, for joining us. Have a great afternoon.
Record.